Welcome to our monthly message. I'm Kevin Norton, CEO for Leahy Health Behavioral Services.
And I'm Sullivan, Chief Medical Officer.
So as the Chief Executive Officer, my role is predominantly to focus outside of the organization to find out what's happening around us, both at the local, at the state level, and at the national level, and to make sure that our organization is in the right position and poised to respond to the community needs, but also to be able to respond to the national needs and the national regulations. And then internally, my focus really is to lead, in conjunction with my partner, Sullivan, the organization forward to make sure that we're providing the best care possible.
So my role as Chief Medical Officer is really to oversee the health care that we're delivering across all of our units, and also to see how we, Leahy Health Behavioral Services, can offer the best possible behavioral health care to all patients throughout the Leahy Health system. So my job is to help drive improved quality by introducing evidence-based practices across all of our clinics and residential settings, to stay on top of what's new in our field, to make sure that we offer a terrific ongoing education for all of our healthcare providers in our system, and to work with Kevin to make sure that we're offering the highest quality and lowest cost care. Because we're really after what the Institute for Healthcare Improvement calls the triple aim, which is the best possible care for our population, the best individual care per patient so that we're happy with the care we receive when we're patients or when we're delivering care, and also to do it in a way that's most cost effective.
And I would say together our role is to make sure that we demonstrate how to have fun at work every single day.
Yeah, I think my dream, and I think Kevin and I are working hard daily to achieve this dream, is to break down silos within our organization and to break down that ultimate silo which separates the mind from the body. We really want to deliver whole person care. We don't want to see the stigma of behavioral health care continue, but really see our role as taking care of the mind and the brain within a health system that delivers the greatest possible care to the whole person. And some of the ways we're taking baby steps toward that are our efforts to make sure we're embedding our own behavioral health counselors in primary care settings across our organization, to make sure that we're partnering with OBGYNs across Leahy Health System to make sure we're finding any depressed young mother, to work with pediatricians for the same reason, really to make sure that there's not this gulf between what we offer in physical care and what we're able to offer our patients on the behavioral health side.
And I would build on that very simply by saying that my dream would be that our organization and the services that we provide get paid for adequately, so that we have the ability to adequately pay for our staff, and that we can also provide facilities that are respectful to our staff and to our clients. So for a long time I was CEO by myself, and I had a great deal of apprehension about having a partner. The surprise has been that somebody else joins the table with a radically different skill set, and I feel like I walk into meetings with a much more robust ability to respond to the challenges in front of us, because somebody else comes with a different set of skills and a different headset and has added a complement of resources that I think make us a better place to receive care.
And I've been in the business for almost 30 years now, and I have to say the past couple of years have been the most exciting of my professional career. I've learned a whole lot from Kevin over the past couple of years, including that he occasionally tells me I'm bad at math, but I'm learning. I think that we together do make a terrific team. I've spent my life as a very small provider of behavioral health in a very large system, and Kevin has spent his career in a pretty big behavioral health setting that hasn't been so connected to medical care. So we bring very different perspectives, but we're able to, I believe, make much faster progress than either one of us from our vantage points could alone. And I'm ready for great things in the next couple of years. think my magic wand change would be what Kevin's already alluded to, which is I'd get behavioral health care paid for in the way other aspects of medical care are paid for. I don't think that's ever really going to happen. I think instead what's happening already is that with the move toward accountable care and global payments for disease states, everybody's recognizing that if you don't take really good behavioral health care of our patients, the total medical cost increases enormously. So that we are kind of backing into better care for behavioral health care.
If I had a magic wand, I'd get rid of stigma.
Yeah.
Mariana referenced it earlier. I think it's what keeps our field from getting paid appropriately. I think it's what keeps our families from being able to talk about issues of mental health or substance use. I think it's about what impacts funding. There is still so much shame that is surrounding the population that we work with and that we've committed our careers to, that if we could eliminate that, I think we could move forward by leaps and bounds.
I've gotten into long distance walking recently, so my husband and I have taken some fabulous long walks across the middle of France and through the Long Skyline Drive in Virginia. But recently, my walks have been derailed because I became a first-time grandmother of my 3-week-old granddaughter, Lyra, which has been exciting.
So on the weekends, I typically try and go horseback riding. And it is not only a ton of fun, and I absolutely love it, but it also makes me focus on nothing else. I realize that I'm standing next to this 1,200-pound animal that could trample me, and that if I pay attention to anything else, I'm in trouble. And I'm happy to say that at this point, I've yet to be thrown, and I've only been stepped on a couple times. And it's a great way to kind of forget about everything else.